Well, they swallowed a great variety. The most common were pens and pencils, and then what was also quite common was razor blades and sharp objects like that, knives, spoons, batteries was very common. This is a chest x-ray of a patient who swallowed a knife blade. So you can see the knife blade here from the top of the esophagus really down to the bottom of the esophagus. This is a long blade, this is about 10 inches. And on the next picture we can show you what the knife blade looks like inside the stomach. You can see that it has these serrated edges. It's lying inside the bottom of the esophagus and in the stomach. And then when it was removed, you get some sense of the size of the blade by comparison here with one of my colleagues' hands. Well, here's another x-ray of a patient who's got lots of white objects inside where their stomach is, and actually these turned out to be made of wire, and these are multiple bed springs. On the next slide I can show you what they look like inside the stomach. There's food mixed up with them, and on the right, after the bed springs have been removed, these are probably 3 or 4 inches in length, and you can see they've got pretty sharp ends, each one of them, so this took an enormous amount of time to remove these. The conventional wisdom is that these large objects like this should be removed fairly promptly, and certainly that's what made us do that. Most of them could be taken out endoscopically by putting a telescope down through the esophagus into the stomach and removing them with a variety of tools that we have at our disposal. And in almost all cases we were able to remove them pretty safely. None of the patients ended up with surgery as a consequence of the procedure, though a couple of patients had surgery because they had swallowed large objects that we just couldn't extract with the endoscope. The motivations behind these people swallowing things is kind of difficult exactly to define from looking through the medical records. So a small number of patients were in prison, and so clearly their motivation was probably to get out of prison for a day or two and to cause some trouble in the prison. However, the majority of patients had chronic psychiatric issues, and they were coming from long-stay residential institutions or in some cases in the community. But about 80% of the patient had some known psychiatric problem. Now, the most common psychiatric diagnosis that they'd received were mood disorders and anxiety disorders. We have a psychiatrist in the team here, and he has a lot of experience with these, what he calls self-injurious behaviors, people causing damage to themselves. And he sees this as part of a spectrum that they may swallow objects to harm themselves or to get attention. And sometimes these people also cut themselves to cause deliberate self-harm. And it's part of this spectrum of self-injurious behavior. And overall, the 300 cases, on a conservative estimate, was over $2 million. And the bulk of the costs were really related to the hospital costs, the inpatient stays, the procedures during the hospitalization, nursing care, and so on. A much smaller amount of the cost, about $250,000, was related to physician fees in the emergency room, in the anesthesiology department, in the endoscopy department, and psychiatry. And then about another $250,000 was spent by the hospital in security. So typically these patients need 1 or 2 security guards round the clock to make sure that after we've taken out the object that they don't swallow another object, which is also a fairly common problem. It turned out that the vast majority of the costs actually were from Medicare or Medicaid, in other words government payers, a small amount of money from private insurers, and some patients had no way of paying for this at all.